Hey guys, welcome back. Today we are going to go over antepartum and the things involved in that. We are going to go ahead and start discussing about fetal development. Now, one of the things that we do need to know is that the egg will always come together with the sperm. Now, I'm not going to go into all the details about, if two sperms get into one or things like that. No, not today. Today we're just going to say when the sperm meets the ova and it fertilizes, we get a zygote. Now that procedure is called an all or nothing procedure, meaning that if you properly match them and you don't incur any issues, let's say, I'm not talking about chromosome issues or anything like that, that would be an all. Or nothing could be, things don't happen, or even if they do, you start having some defects in it, either during mitosis and meiosis or the chromosome match and things like that. So we are going to talk about the first 3 to 8 weeks, and we're going to discuss about the central nervous system. Now, the central nervous system is made of the spine and the brain, and this is something that actually the spine first develops, and then it breaks into the forebrain, the midbrain, and the hindbrain. So that being said, I am going to go over and discuss about the meningocele. Now this is when you have the spinal cord develop and it becomes incomplete. So what you end up having is something like, let's say if this was the spine and this is not closed up, then the spine bulges out. Now if you end up delivering such a child, then you'll probably have the child with a condition called spina bifida. The other condition we're going to discuss is the hydrocephalus, and that is when you have fluid buildup in the brain cavities. And so such children tend to have like slightly larger head size. The other thing we're going to discuss is the anencephaly. Now this is when you have undeveloped brain or an incomplete skull. Now I will not kid you, these conditions will take a toll on the family. This is not something that they were expecting, regardless of how the mother managed the pregnancy, whether they were drug addicts on the street or whether they were everyday kind of person. They expect and hope for a healthy pregnancy. So, this really takes psychologically a toll on the family. Now, all these conditions that we have discussed is related to neural tube defects. These are different components that lead up to neural tube defects. And this is why the doctors encourage the pregnant woman, to either consume their folic acid or the pregnancy vitamin tablets, just so they can boost the supply and help in the process of pregnancy in terms of those vital organs developing right. Okay, so let us talk about what alcohol and smoking does to pregnancy. Now, we do know that when you smoke cigarettes, you are actually causing a state of carbon monoxide poisoning. Now, when it comes to pregnancy, the placenta is something that's supposed to filter the nutrients for the baby. However, when it comes to smoking, that is something that crosses over on the placenta, and so therefore it ends up causing hypoxia. Now, hypoxia is a condition where you have low oxygen levels in your system, and this affects the baby, especially in terms of the brain system, the central nervous system, and its functioning. And we had just discussed how important it is to have a very healthy brain. And so this will cause issues after childbirth in terms of the baby's growth and developmental system, in terms of relation and things like that. And the other one is alcohol that we need to discuss. Now, alcohol is something that just easily crosses over the maternal placenta, the placenta that connects the mother and the fetus. And what it does is it can put the baby in a condition called fetal alcohol syndrome. Now, Some people think that, you know, maybe if you drink a bottle, that's when it does. But even that, just that one sip of alcohol can be very detrimental to your baby, because it can cause some learning disabilities and developmental delays when it comes to learning. And that is not something that you can just easily fix. That is kind of set in stone. So these are the reasons why it's very important to really leave a pure and healthy lifestyle during pregnancy. Now, back to the week in relation with pregnancy. Now, week 5 is when the heart starts to beat, and as the pregnancy progresses, by week 8, you will experience the heart being fully formed. Now, there's certain conditions that if you get to experience them while you're pregnant can be very detrimental. So something like rubella. Rubella is it's also called German measles, and it's more of a rash condition, but it also affects the lymph nodes. They tend to become enlarged. So this can actually affect the heart. And what you might end up getting is congenital rubella syndrome. Now, this is something that will give you some type of cardiology defect or malfunctioning, and that can be, you know, very, very challenging. Now, let's talk about the limbs. Now, when I talk about the limbs, I mean from the time when the limb pallets were formed, in terms of, you know, oh, this is going to be the socket where the hand is going to grow out of, and things like that. So that starts by week 3, and it stretches out as the limbs grow out to week 8. Now, should you have any condition, any problems on those plates, any problem that affects the delays of those limbs, you're probably bound to have some limb issues. The other one we need to discuss is the lips and the palate. Now, they start forming by week 6 and complete by week 9. Now, if they are not fully sealed in the right places, then you are probably going to end up with a condition, either the cleft lip or the cleft palate. And this can be very challenging, especially when it comes to breastfeeding. So you will probably end up having to use special types of either the breastfeeding bottles and things like that, just because the children tend to have a more challenging time latching onto the breast. So that is for that section. Okay, so we have a question here. A woman in the prenatal clinic asks when the baby is due. Her last menstrual cycle was August the 25th, and now we're going to use the Nagel's rule to calculate the estimated date of confinement, or as we call it, the expected birth date. Now, there are 2 ways of calculating this. Option 1 is, first make sure you ask them the last menstrual date, and they'll probably tell you. And what you do is you can deduct 3 months from that, and so it's August, July, June. So you kind of know 3 months would be in actually July, June, and May. That's what it is. And so you land on May 25th, and you get to add 7 days. So May has 31 days, so 6 days will go into that, and that 1 day will go into June. So you get June 1st as the birth date for that kid estimated. The other option to do that is just calculate 9 months from that time, and that will also put you at June 1st. Okay, so we are going to discuss the changes that happens to the pregnant woman. Now, let's talk about the vagina. Now, for the vagina, because you are going to, you're having the baby going to pass through that, the fetus, you will have a lot of more blood production, more the veins and the arteries down there will be more vascularized. And the reason being is because they need to that is the area, you know, between the womb and the vagina that is helping in the growth of the child. So there'll be a lot of vascularity in that area. Now, because you're having so much increase in production of so many different things down there, you have a higher chance of having monilial. And what that is risk for production of candida because of yeast production, and that will predispose your child to having thrush. So just have that in mind, and we had discussed the treatment for thrush, which would be nystatin. Now, you will have an increase in vaginal discharge, but if you're having spotting during pregnancy or menstrual cycles, then you need to contact your provider, because over time that is not normal and it can be of much danger to the unborn child. The other thing that you experience is breast enlargement, and this is just in preparation for breastfeeding for the baby. You will, if you get to squeeze your nipples or your areola, you're probably going to see some colostrum come out, and it produces more when it's closer to childbirth. You'll definitely have some skin changes. Now, there are people that get darker skinned or more oily skin, or it just becomes very dry skin. There is a linea nigra, and that is a dark pigmentation line that comes from the umbilical cord going down towards the vaginal area. It's just one straight line, and after childbirth it tends to disappear, but it really darkens and really becomes auspicious when it is during that process. The other thing that some people tend to have is the Montgomery tubercle, and what that is around the areola, like the dark part around the areola, you get to see things, they look like pimple-like. I guess that's the best way to explain it. It's not, you know, it's not really rampant, but you'll get to see spots around that area. And those are things that do tend to resolve over time. We have the chloasma, and that is what they call the mask of pregnancy. Reason being is there's a pigmentation change around the cheeks. Then we have the cervix. Now, the cervix by nature is normally long, but during pregnancy it shortens, and the reason being is so that you can have a more faster delivery. And then it widens. The reason why it widens is so that it can make room to accommodate the size of the baby coming out. You do have the mucus plug that starts to form when you get pregnant, and it seals that opening by the uterus to the vaginal canal, and that continues to thicken as the pregnancy progresses. Now, one thing we do encourage pregnant women, and even both male and female people out there, is Kegel exercises. The reason being, once the pregnancy really advances and starts to put pressure on the bladder, or people tend to either not be able to control their bladder well. And so Kegel exercises step in terms of trying to strengthen those floor muscles, and that really helps and goes a long way during childbirth. Now, the other reason why I put prostatectomy down there is patients who have had this kind of a surgery that involves the prostate, they tend to not have good control of their bowels, or rather their urinal canal. And so they are encouraged to do the Kegel exercises. By doing that, you pee a little and hold, and pee a little and hold, and pee a little and hold. And so by doing that, it helps curb this issue of dribbling urine. Okay, so now let's continue to other systems of the body that get affected during pregnancy. Now, for the respiratory system, now that is something that because you're going to need more energy in terms of production of the fetus, your air volume is going to increase by 40 to 50% during pregnancy. Reason being, you're going to need that much oxygen to be able to supply it to both you and the child, and also in terms of energy production. So you need a bigger supply of blood, so there will be a higher production of the iron. The cardio system, by the end of the second trimester, you will have increased by 50% in terms of cardiac output. So probably their heart rates are going to be a little bit much faster, but more necessarily the output of blood that is being pumped out will be much higher because of the needs of the body. The other thing is, the big concern here when it comes to cardio is when you have pregnant women who have heart failure. It can be very dangerous for them because you're having a higher amount of function for the cardiac system, and the problem with that is they're already in heart failure, so that predisposes themselves into a more exacerbation of it. So that's something they get to be closely watched, and depending on the level that they are with heart failure, some of them are put on complete bed rest and things like that. And in terms of medications, that would have to be adjusted. Now let's talk about the GI system. Now we all know about during the first trimester when people struggle with nausea and vomiting. Not everybody, but a couple of people do. But that ceases after the first trimester because the hormone levels get balanced out. So that high production of hormones is what causes a lot of that discomfort in terms of the GI system and nausea and vomiting. Constipation and heartburn is more of an issue in the second and third trimester. Reason being, the baby is growing and pressing onto other organs. So the baby grows to and pushes the diaphragm up. So that gives you very little room to wiggle around in terms of your GI system. And that's why they encourage women to drink lots of water and do a lot of roughage just to help and control that constipation. The other thing that you need to realize is now you need energy for not just the mother but also for the fetus. So breakdown of food is at a much higher rate, and that increases by 20%. That's why you get pregnant women who walk into the room and start saying, open the windows or turn on the AC. Can't you guys feel like it's hot in here? But that's because their metabolic rate is much higher. Now let's talk about the urinary system. Urinary frequency is increased in the first and the third trimester just because of the body changes. And also in the third trimester, the baby presses onto the bladder sometimes. So the room that you'd have to accumulate urine is much smaller. Now, there is a higher chance of getting UTIs just because we had talked about the vagina producing more secretions, more discharge, but also with the urinary frequency, you have a higher chance of UTIs. Weight is another thing. Now, for a normal healthy baby, you're technically supposed to gain between 25 and 30 pounds during the pregnancy. And the first 25 is more for the blood, the baby, the placenta, the womb area, and things like that constitute to that 25%. Now, if you get to gain more than that, then chances are when you get to give birth, trying to lose weight can be a challenge. Now, let's talk about iron, folic acid, and prenatal vitamins. I had stated earlier that it is very important to have the prenatal vitamins and the folic acid. Now let's talk about the iron. Because the baby does not make iron during the first 6 months when they're born, they get to store from the mother. They take from the mother the iron that is in the system so that they can be able to have a supply for 6 months. And that's why you get to find that most pregnant women go for doctor visits, and then the doctor says you're becoming anemic. It's not that she's not taking iron, it's just that the supply that she's taking in is not enough for the baby and her. So that's why they encourage you to take iron tablets. The other thing you need to know when it comes to pharmacology is iron tablets predispose you to having constipation. So that's just something to know. Let's talk about the endocrine system. Now, the endocrine system is also in overdrive. So that's when, things about metabolic rate come into play and how everything is much higher than expected.